So the idea of screening someone for a disease process means that you're taking a patient who is asymptomatic, so has no symptoms that we can attribute to the disease process, and look for that disease. Current screening includes mammograms for breast cancer, PSA tests for prostate cancer, colonoscopies or Cologuard, screening for colon cancer. At this point, lung cancer screening is reserved for patients who are considered high risk, and that includes criteria such as extended smoking history, asbestos exposure, significant secondhand exposure, family history. You could take those patients and then say, well, let's look for cancer, having no reason to think they have it because they don't have any symptoms, but look for it anyway. The only approved cancer screening for lung cancer is CAT scans of the chest. Only current approved screening modality for lung cancer is what's called a CT scan or a CAT scan. And that's an imaging test. We take pictures of the inside of your body. The idea of a low-dose CAT scan is to minimize the amount of radiation that the patient is exposed to while getting the images that help us find these nodules or masses in the lung. The current recommendations are low-dose non-contrast CT scans for patients who are considered high risk. That includes certain demographics like age, smoking history, and exposure history. There are some clinical trials that look into non-smokers who may have a genetic predisposition or a family history of lung cancer, or who have significant secondhand smoke exposure without personally being exposed to cigarettes themselves. Again, my name is Michaela Straznicka, and I'm a proud member of the BASS Medical Group.